you have our commitment and our partnership to make significant progress together.
Welcome to Healthcare Blind Spots. I'm Vivian Kofsinger-Birchall, your host, and my special guest is Dr. Ahmed Al-Zawawi, who is a PhD and a professor at Suez Canal University in Ismailia, Egypt. And I hope I pronounced that right. He's also the chairman of the Al Suleiman Clinical and Radiation Oncology Center in Egypt. And he has quite a lot of accomplishments in global oncology and has won awards. But anyway, I will just invite him to tell us a little bit about who he is and what he does. Professor, Doctor, welcome to this show.
Hello, thank you very much for this nice occasion. In brief, I would like to summarize that I am Ahmed Al-Zawawi. I am, in addition to my local post here in Egypt, I am founding chair of International Campaign for Establishment and Development of Oncology Centers. And I share the scientific win-win initiative and many other posts and many other activities in the world, but all are concentrating on one point. You'll find a long list, but concentrating on one point. It is the challenge that we have in the world nowadays, that widen the gap between what is required and what is available of cancer care, better value, best value, value-based, scientifically based value in the world. The affordability is there is a tragic shortage, and this, to be clear and without going into slogans about disparities, inequalities, and all these things, without going to the depths of the problem, that the gap between the required and the available widened in the last 2 decades, despite of all conference, festivals, World Cancer Days, meetings, publications, declarations, agendas, initiatives. So we should face this. With all what we are doing in the world, and I am part of this. That is why I said this long list. You will find long lists of contribution, many things. So I'm not blaming others, because I was modest person on all these things, and I'm proud of this. But the reality that the gap is widened, and in front of us nowadays, a real challenge. Despite of all nice speaking about closing the gap, but the gap is wide. Second thing, that the crisis is not only in lower and middle income countries, as we sometimes we say is global. That is to say, some poor country in Africa, in our continent. I am from Africa, so it is to speak global than to speak about this problem. No, global is global. Global means the world. The global is the clue for the problem and the key for the solutions also. Because now in the United States of America, I said this is according to the ASCO data, American Society of Clinical Oncology, there are nearly 40% of cancer patients in the United States of America are suffering from lack of affordability of good value cancer care with dignity. 62% of the cause of bankruptcy due to diseases and due to sickness in the United States of America, 62% are due to cancer, and there are increasing skyrocketing increasing of the total cost of cancer care, without we having the same increase in outcome. Also, you find I speak about the United States because you can imagine when you say United States, then you can imagine what is going on low median income countries. It is tragic. When you say in the United States of America, the first cause of cancer, fear of cancer now is not all these studies about fear about the first cause of fear is due to financial burden, is the bankruptcy of the family, is its effect on the present generation and maybe the next generation of this family, the father and the mother and the kids and all. This is the first cause of this is coming due to due to the fear of cancer burden, financial cancer burden, come before the fear of death and the fear of pain. This surprisingly, this data, this new data in United States, and in the same time, we are concentrating about stereotype data about, for example, that we should arrive to this is not you can't arrive to this to zero cancer percent in sub-Saharan Africa, 0 cancer percent of cervical cancer, but this is just I say this is just speaking because first it is impossible. Second thing, that in the United States of America, the last year, the increase of advanced cervical cancer cases is increased among white women more than African Americans. So that is why we are just speaking about stereotype things without going to the depths. The depth of this, that there is many incentive to increase the total cost of cancer treatment. There are many complicated. It is full of complexities of causes, and mostly it is economic and scientific and many things. So to cut short about this, because this is we wrote a lot about this, but we are not in the win-win initiative. We are not for speaking about much about magnitude of the problem. It should be done about the fears, about the challenges, about the obstacles to cancer care in Africa, obstacles in cancer care in India. No, but we think together how to solve. This is the role of all of us as scientists, as doctors, and how to solve, or not necessary to have the magic stick for to solve our problems, but how to make scientific approaches. This is our role. And surprisingly, as I presented many times, and I published this, and you have a copy of this book, you find that, and this is surprisingly, ladies and gentlemen, all over the world, there are hundreds of scientific approaches that by many authors. We are not inventor. We didn't invent anything. And this, surprisingly, there are many scientific approaches that could lower the total cost of cancer. I speak a total cost, not the price of a drug per se, or a machine per se. How to treat with the same, what you have, more numbers of patients, and how to treat them well, how to get this treatment with dignity. What I mean by dignity, always social, financial, physical dignity, and economic dignity, everything. Dignity has to be treated. This is not a reason that a person or a mother or a father of a family or a kid to have, because they have cancer, it is become humiliated from every point of view because of cancer. So but there are many scientific solutions. You find it in that last example. And what we now starting is global oncology, implementing science, because it is based on science, to make courses, and this is through our global oncology university, and this course will start soon. And we need you, Vivian, please. We need all persons to promote and advocate, because we say that win-win initiative is not mine. It is not my colleagues, Professor Wilfred Negwa, because not David Kerr, is not Eduardo Gazab, is not all these distinguished faculty who are with us, but it belongs to all. belongs to all, and you need your advocacy, you need your involvement, you need to read what we wrote, and what we wrote is not our production. In fact, we are just collected, and surprisingly, there are many hundreds of scientific solutions that could lead to increased affordability of better value cancer care within win-win scenario. What is win-win scenario? That we are in the real world. All all stakeholders will gain. Companies will gain more. Science will gain more. Industries will gain more. The community will gain more, and surely the human beings with cancer everywhere will gain more. That is why we are considering the real incentives and interests of the world. How, for example, we have many examples that how we can this treatment become more available for many, and at the same time the industry will gain. We are very keen about this. Otherwise, we'll continue to say theoretical things and romantic things. Yes, behind
Absolutely.
this is behind this our romantic heart, our love to all human beings. But when you speak about solution, you have to deal with the real world. We say to industry. That is why there are some big names in industry with us, because they know that they will have crisis. They can't continue like this.
Right.
We are not against industry. We can't against companies. We are not against pharmaceutical. No. But we say that we can't continue like this. The human being, the rich countries can't continue like this, and imagine that how we can be in developing countries. That
No,
is why we say win-win, and it is global. When we find a solution, you find a solution. It could be you discover it in Uganda on Chile or something, but it could be beneficial for a person in Stanford or in Texas or whatever. You know, that you say global. The key is global. All will win, and the who will gain more now, will gain more with the win-win initiative. Will not win less. We don't say sacrifice or charity or begging from any pharmaceutical or any. We will gain more, but the poor and who will have no access to care will find the necessary thing with dignity. This is all. We need you all.
No. That is amazing, Dr. Ahmed. It's good to just hear this kind of comprehensive view on what you want to see in the world of oncology. So, but to take us back to, you've mentioned the win-win initiative a lot of times. You've mentioned the Global Oncology University a number of times, but for the benefit of our viewers, obviously I know what all those mean, but what is this win-win initiative, and what is the Global Oncology University that you've been talking about? Very briefly.
The win-win initiative started in December 2007. I published it in a medical journal with the cooperation of many. And this even the term is developed by collaboration and by with the discussion of many colleagues in the United States, in Oxford, in UK, in Germany, and even with the, you may surprise with this with vice president and president of big industry. Well, they give me information, by the way, and you find in this in our presentation, in our book and everything, there is a part written, frankly, by CEO and president of some big industry, leading industry, because it is consider all the interest and incentive and of all. It is aimed at how to use scientific approaches, how to concentrate our scientific approaches, our publication and research and everything. It is to unlimited current of scientific studies and research to increase, to lower the total cost of cancer. I speak about total cost and not cost of per se of a drug or a device or machine per se, but the total cost. This is broad scope, total cost of care, and increase its quality of life of this patient without compromising the outcome and their welfare. Is it possible? Yes, it is feasible, and we showed many hundreds of examples already of published data by many authors in the world. I don't know why we pass about it. In a big conference, we always we don't show these big data and big studies and by many in the world. Really, we are thankful for all of them. Second thing, this initiative now, these are many professional and distinguished persons are involved in it. And there is a big list you'll find in our last book. There are more than 100 contributors. And there is the foreword of the book, even by Sir Moore Gray, who is the initiator of the triple value health care and triple value cancer care and healthcare in general. Still, you find her Royal Highness Princess Dina Mirad, who is the past president of the international of the UICC, International Union Against Cancer, and you find many personalities in the world. They are involved with all hand in hand, because we don't claim any personal glory or any personal invention, but it is a forum for all, and we invite all organizations. We are not, the win-win initiative is not one more organization. It's two competing organization or rivalries or challenging. We are completing. We are a forum for all, and if we succeed, there is place for all to succeed and to lead. Welcome. Come and lead and suggest something and lead it and lead this activity. It is a forum for all and not one more organization. To fulfill this objective, and then there is a need for education and training, and we need recruitment of the many people in the world, and that is why we have this global oncology university, which is virtual, free of charge university. This is a dream of me and my brother Wilfred Negwa and many other colleagues in Harvard, in Johns Hopkins, in Oxford, in Gothenburg, in Sweden, and in Heidelberg, in many parts of the world, and surely in Tanzania, in Uganda, in Kenya, and in Argentina, and many parts of the world, free of charge, virtual education and training that can carry this message, and that the only way that, or one of the most important way, to be correct, precise, to that others, because it is important that particularly the new generation and the new cancer professionals who raise the flag, not me, not my colleagues, but who raise the flag and who invent more solutions, who search for more solutions, who can be the leaders, who can guide it in the upcoming years. That is why it is important to have this big current in the world by our colleagues everywhere, from everywhere in the world, everywhere, all are invited. So that is when we'll start next month our courses of global oncology implementing science. Before, we have courses in surgical oncology by Professor Ricardo Odesio and colleagues in Imperial Society of Surgical Oncology. We have before clinical trials by the colleagues in Oxford, Professor David Kerr and others. We have planning in, and we have, of course, now current course by Professor Siful and Stephen Avery of medical physics. We have this education and training is very important. So we hope to see after a few years that if we live, I don't know if we live but at least there are many hundreds of persons around the world, I hope thousands, who raise the flag and who go forward with their scientific approaches, because we are science, we are scientific. We are not speaking about slogan, speaking about hopes and about unaborted wishes. No, we are speaking about scientific thing and achievable. And the measure of success is one thing. If we see, you and me and our colleagues see more enormous number of cancer patients, of human beings in the world get the treatment with dignity, then this is the success. No other measure.
Right.
Not speaking, not books. Yes, we have books, we have publication, we have interviews and everything. But what is more important is this: is to arrive together to tangible, to touchable thing, and beneficial effect on human beings, regardless of their nationality, color, religion, or where they are, or their geography. This is our goal, exactly in short.
Right. So, in terms of the courses of the university, how many courses do you anticipate to have on that Global Oncology University? And how do you decide who takes the courses? Can anybody, even somebody who's not an oncologist, access the courses? If not, what are the criteria? What's the criteria for accessing those free courses?
It depends on the program.
Okay.
If it is a program of medical physics, for example, then it is for a medical physicist. It is necessary to be. No. But sometimes for some course of medical physics, it could be also for a radiation oncologist, for a technician in radiation oncology. When it is course of surgical oncology, it will be for young surgeons and interested in cancer treatment, who are practicing cancer treatment. This is really a professional. It is not public education. Yes, we can have, after we have this part of public education for cancer information, awareness, and everything. But we have some point about this, and you find it in the introduction of our book and the first chapter, that sometimes we are running after the term awareness, screening, early detection, and without thinking that sometimes it gives the burden of coming late on patients, on the people, because they are ignorant, they are not aware. But if you would like to give them an advice to drink clean water, then you should be, it's affordable with dignity. But when you say detect human being cases, they are not numbers, they are not statistics, but everyone have a heart, have pulse, who have his pulse, has his heart, has feelings, and then you discover this is a cancer case, and this has become the beginning of the catastrophe of lacking of service and humiliation and destruction of the family by many factors, and to go far for distant, even the treatment if available, but available far. And there's a family, there are kids, there are many things. So we address this. Believe me, human beings everywhere are not no ignorance that as we think. Even if you see in the jungle, I saw people, and I saw people, and this is not speaking from my office or something. No, I saw people in many parts of the world. I thought the most people who consider ignorant, and sometimes I learn wisdom from them. He can't read and write, but he tell you wisdom that summarize a long life. Surprisingly, just offer for them and say that if you have this science, go there and you'll see your treatment. And this is we should concentrate on this. Don't say drink water while there are no waters. Don't say we should be detected and go to examine, but after this will become the start of a hard journey. And this is bad experience is transmitted. We like or don't like, transmitted among people. Any female who have a sister or a neighbor or something have a history of that her neighbor or one of the relatives suffer a lot of cancer, and she have some signs. She start to hide it. She start to postpone why? Because there'll be start of a big burden on her family and herself, and she can't afford. And but if believe me, if that is why we connect always everything with availability of service, and then make advocacy. Come be examined, come to have awareness, come to have a screening. And if there's something, no problem. You will find the service and you will do life as most as we can, will not be much disturbed. Yes, there are some cases, late cases, whatever, the countries, there are still percentage, unfortunately, who can lose them. But at least for most of patients, nowadays, we can do something beneficial through science. And then this is the most, I say, this is the most provocative and the most would be the most successful call for earlier diagnosis or disease. But I see, my person, I'm sorry for this. I see that all this festival, all this awareness campaign, this is a torture for human beings. This is you said if you come to see to be examined or something, but after if you find a problem, will become a start of a very painful and distracting journey, and there is available and lose of dignity in everything, financial dignity and social and everything. No, and physical dignity. Okay, we travel for far. We see patients everywhere in some part of our countries, in Africa, in Asia, and they are sleeping in the earth for days away from homes, waiting for treatment, and then you will say, come to be diagnosed early. This is nonsense. This is nonsense. Start to afford the available things. And believe me, human beings are intelligent, more than we imagine. Yeah. And they would like to get the welfare more than we imagine. If you see them poor and everything, because this is what they have. They adopt their lives according to the facilities that they have. This is not. It is not. They don't love to live in a very bad condition or unhealthy condition. No. Just help them, and they will be very cooperative, and they will be the most powerful advocate for what you are calling for. Because we count on them. We count on their contribution, because after all, it is patient, or better to say, human being center. Yeah. It should not just data or treatment or percent of survival, but should be human being center. Right. Meeting their expectations in their present and their future. This is very important.
Right. Thank you again, Dr. Ahmed. I mean, one of the questions I had for you, which you have kind of touched on, for this past half hour or so, is what your vision is for this Global Oncology University. What you hope to see in, say, in the long run, not just the short term. And I don't know whether you can just add to what you've already said, like in summary, what is that vision and what do you hope to see going forward?
Is to see that is stimulating, or like a spark for a big current of scientific movement by thousands in the world, to concentrating on how to increase affordability of better value cancer care for millions of cancer patients in the world with dignity. It is transforming this, not just courses, education, seminars, but to be transformed by the audience themselves, to be the leader of big current, scientific current that will be a big change in the world. All will gain, and that I would hope to see that all are involved with industry, scientific, academic institutions, organizations, societies, and surely media is very important. Media is very, very, very important, because I hope that to promote for cancer care, for better value cancer care, this is via you. Your role is important. I hope that, to see that treatment is possible, but we should cooperate together in this scientific research and something to make it possible. And this is what I mean by implementing science. Is not just a solid term or philosophical term, but how this discovery of innovation become adopted and be used by me, by him, by others in South Asia, in Africa. This is implementing science, because any scientific discovery or invention or articles or application or news in the scene or in the media, it is not achievable task. But to be complete is to when it's find its way for applications without much suffering for a normal, for ordinary human beings like me and like ordinary citizens everywhere. This is what we aim to, and we hope that we'll be achieve it together. Please, we need your hand, we need your support, we need your support by working together, not financial, but working together. Promote for better value cancer care, and it is feasibility, and it is possible, and it is feasible via science. And also second thing, that it is all will win. It is not against the gain of any stakeholder, but all will win, and the winner will gain more and not less. But who haven't now will have the necessary human things, the necessary thing to live with dignity and to be treated with dignity.
Absolutely, you can count on my support and as a partner in this win-win initiative, because, like you said, rightly so, that I believe media plays a critical role in passing on the information to other audiences. So thank you so much. Is there anything that we haven't? I know that I'll get you back in the future, in the near future, maybe to talk more about the Oncology University, but Global Oncology University. But in the meantime, is there something that we haven't talked about that is more urgent to tell our viewers today?
We will start soon the new course of Global Oncology University, but we have already now medical physics and surgical oncology and other courses. We need you to promote for us and to make communication, and because our success not to hold some courses or some, but it is how to diffuse widely the message and how to encourage other partners to join. For example, we have e-cancer medical sciences joined us, and we will have their logo on the courses. And there are some organizations will have also their logos, and we say welcome all. It is not mine, it is not yours, it is belong to all us. Come to share and put your logo and be partners and diffuse this information to all. If you what is needed now urgently to diffuse this message to all society and organization. We are not challenging, we are not competing, but we are complementing and welcome all. It is a forum for all, and we succeed if we are all. We need you to diffuse the message to the maximum persons in the all scientific community and the population in the world.
Well, Dr. Ahmed, thanks for driving this vision. Thanks for the leadership role that you play, and for the entire team that is working with you on this initiative. Would like to say thank you for having that vision, for really being proactive in bridging this knowledge gap in oncology. So thank you very much. And to our viewers, really thank you for watching this episode of Healthcare Blind Spots. Look out for more videos about oncology, global health, and all these win-win initiatives. Thank you for watching. Till next time.